and how does this affect GPs? It's changed a little bit as we've gone along, and it's going to have a real focus on end-of-life palliative care packages and the resources available. So we'll touch briefly on the Aged Care Act and the changes, and then we'll focus on palliative care. Tonight we're recording it, so the transcription will be available afterwards. And I'd just like to acknowledge country and acknowledge that we're meeting tonight on the lands of many Aboriginal nations across Western New South Wales. I'm joining you from Wiradjuri country in Dubbo, and I want to pay my respects to the Wiradjuri people whose connection to this land stretches back thousands of years. Western New South Wales Primary Health Networks respectfully acknowledges Aboriginal and Torres Strait Islander people as the traditional custodians of the land and affirms the commitment to building relationships with respect and creating opportunities with all Aboriginal people in our region. I particularly like to acknowledge that we need to consider all Aboriginal people in everything we plan and do if we're to continue to close the health needs gap. And I also want to pay my respect to Elders past, present and emerging, and extend a warm welcome to all First Nations people who might be in the meeting tonight. So thank you. Tonight, your presenters are Louise Rawson and Janet Shields from Western New South Wales Local Health District. Louise Rawson is a clinical nurse consultant with the Aged Care Services at the LHD, and Janet Shields is an Aged Care Service Relationship Manager for the Out of Care Services, also at Western New South Wales Local Health District. I'm Diana Carbines. I'm Manager Aged and Palliative Care here at Western New South Wales Primary Health Network, and Natalie Camilleri, the team manager for our practice development team, is on hand tonight. If we get questions that are more general practice orientated, Natalie has joined us tonight to help answer those questions if needed. We've got a fairly full agenda tonight, so we just ask if you would drop questions into the chat as we go. We may need to take a number of the questions, particularly the Aged Care Act changes that you might have questions about, on notice and provide more information towards the end. In terms of housekeeping, yes, I mentioned just hold off your questions until the end of the presentation, or there will be opportunities in the chat during the presentation, and just drop them in the chat. If you could remain on mute except when speaking, it does cut down the background noise, especially if someone comes into the room and has a chat with you. It's important to maintain patient confidentiality, and so if you could keep that in mind as you go, and the recording will be edited if there is anything that comes up that might breach confidentiality. We've got an evaluation, a QR code at the end of the session, and we would strongly appreciate your support to complete an evaluation. It's very valuable to us, and it helps us to understand if you got what you needed out of this and if there's other things that you might need for a future session. And yes, just reminding anyone who's just joined us that the session is being recorded. So the learning outcomes were created a little bit before we wrote the actual presentation. So we're looking to describe for you how the levels of aged care packages are changed to the levels of support at home. We want to clarify that the grandparent clause applies and that the CHSP program has an extended end date. We want to support you to understand how to determine eligibility and document for the end-of-life pathway packages, the palliative pathway packages from the 1st of November. We want you to know how to access and complete the end-of-life pathway form and the checklist. And we want you to know what you might do differently for your patients that have no aged care current supports versus patients who have got aged care services in place. We would also like you to know how to access palliative supports for younger patients who are not eligible for aged care services. So I've mentioned who's presenting for you tonight. Louise is going to be presenting about the support at home and the end-of-life pathway, which is the Commonwealth funded pathway. And just to try and confuse you more, the state End of Life Pathway is called End of Life Pathway, and that's the state funded one. And Janet Shields will be presenting on that. And finally, I've got some useful links and resources at the end of the presentation that you might like to access after this meeting. We will drop some of the links for those resources into the chat as well for you to make it easy to access straight away. So from the 1st of November, we know that the aged care system is undergoing a major transformation, and support at home program is what's coming in to replace the current program. We're going to see expanded home care levels and changes to residential and home care fees, and Louise will cover more about that as she talks to you. And it's replacing the home care packages program and short-term restorative care. There's new age limits. It's slightly changed. The Act limits entry to funded aged care services to people with care needs who are aged over 65, Aboriginal or Torres Strait Islander and aged 50 years or over, and homelessness or at risk of homelessness and aged care 50 years or over. That's the aged care change. It used to be 45 years and over. Existing clients who are approved for aged care before the 1st of November 2025 are still eligible because they were approved previously. And people who are aged 45 to 49 who already received CHSP will continue these services if they were assessed before the 1st of November. So no change for people currently receiving CHSP services. So for people that were approved on or before the 30th of October this year, there's no change. They don't need to worry. There will be no change to their costs whilst there is no change to their existing care package. There are what they call grandparent clauses, not grandfather, grandparent clauses that apply for existing clients, and that protects the existing arrangements for them. And the CHSP program has an extended end date. It's now the 30th of June 27. So I expect we'll hear more about that closer to that time about the ending of that program. But that's 12 months away. 9. So from the 1st of November, you'll see 3 service categories under the Support at Home program: your everyday living support, independent support and clinical care. Most of what's described there is no real surprise. It's still the same types of services. They're just described in a different way. The one you might notice the most difference is assistive technology and home modifications. And you might sometimes see the acronym or the abbreviation ATHM, meaning assistive technology and home modifications. So these key changes that are happening will provide more tailored support with finer graduations of care needs. It will provide unspent funds will be retained by the individual, faster access to assistive technology by a new equipment loan scheme, and you might sometimes as a GP be asked to sign a letter confirming that it's appropriate for someone to have, say, something like a personal alarm rather than having to wait 6 months for an OT assessment. Home modifications is still included, and integrated model will combine home care packages and short-term restorative care. And once again, Louise will talk more about that. So there'll be greater flexibility, improved transparency, simplified access through a single assessment system, which is what was currently in place, rights-based, much more focused on what the person wants and the packages being with the person, and better alignment with the individual's care needs. So I'll now hand you over to Louise for her part of the presentation.
Beautiful. Thanks, Diana. Hello, everybody. Thank you so much for allowing me to come here and speak to you tonight. I'll be speaking about the end of life pathway, which is a new pathway the Commonwealth are putting forward for people who are experiencing an end of life, just so that they could, if they choose, they can pass away at home with supports in place. So first of all, I'm going to talk about support at home because that's what end of life comes in on. So Diana, if you wouldn't mind moving on to the next slide, please. So as Diana's already said, 1 November is D-Day. It was meant to be 1 July, but we're going to 1 November and we are all go for it. We'll get go, no go on Sunday apparently at 5 p.m. But we're anticipating that 1 November all of this will come in place and home care packages and short-term restorative care program will no longer exist. They will be considered to be part of the support at home program. The big changes to the support at home program will be that there will be 8 classifications now for ongoing care. So that's long-term care. And new clients who are approved for support at home classifications 1 through 8, they will work on a quarterly budget and they will be able to carry over 10% of that quarterly budget or $1,000 every quarter, whichever number is greater. And all support at home classifications will be means tested. So the idea is that everybody pays, but the Commonwealth will still maintain that financial hardship consideration for those people living in our communities who are experiencing financial hardship. So you can see that the range for the support at home goes from about 10,000 per annum to about 78,000 per annum, and those numbers keep changing, but the big number kind of stays the same. So that's the ongoing support at home classifications. The other items that come in under support at home are short-term programs. The end of life pathway is what I'll speak about most. So that's about $25,000 for somebody to access support for 12 weeks at home so they can pass away at home. There's another pathway called restorative care pathway. That's a community reablement program that can last up to 16 weeks with funding of around $6,000. The Commonwealth have put some caveats in that the packages will be capped at $5,000 per quarter, and they will inform the assessment organisations when we're getting close to that 5,000 cap, and then apparently we should think of something else. And the other short-term program is the Assistive Technology and Home Mods scheme, which Diana has alluded to. They're very separate. So one is assistive technology, one is home modifications. A client can be approved for both or either or. The duration is 12 months with the ability to have a support plan review to get another 12 months. The 3 categories are high, medium and low. So it just depends on what kind of assistive technology or home modifications the client may require. They can access anywhere from $500 to $15,000 in that 12-month period. So I think if we go on to the end of life pathway, and the terminology is what the Commonwealth have given us, so we are calling it the end of life pathway. It is part of the support at home program. It's for people who, as I said, want to pass away at home. They need to be in the last 3 months of life. It complements any palliative care schemes that is already in place with the state, with New South Wales State. So it doesn't take over what is already in place. It's just offering additional support. And it's the highest funding classification per day that the Commonwealth can offer somebody. So it's higher than a level 3 support at home classification. If you want to move on to the next slide, please. To be eligible, you need to be eligible for aged care services under the Aged Care Act. So as Diana has already said, you need to be over 65, or if you identify as Aboriginal or Torres Strait Islander, you need to be over 50. There needs to be a need for you to have supports, so you need to have some difficulty managing everyday tasks, and that those needs can be supported in the community. So if somebody wants to access the end of life pathway, they must first meet that eligibility criteria.
Thank you.
And then if we go on to the eligibility criteria, I think for the end of life pathways, the next slide. So this is the crux of it. So as I said, they need to be eligible for an aged care assessment under the Commonwealth rules, and then they must meet both of the following criteria. They need to be in their last 3 months or less of life, and this needs to be confirmed by a medical or nurse practitioner. And they need to score 40 or below on the Australian Modified Karnofsky Performance Status. So that is that they spend more than 50% of their time in bed. So if they meet those 2 criteria, then they can go ahead and apply for eligibility for the end of life pathway. The next slide, I think, is the AKPS. I'm sure you are quite familiar about this. It is a very easy rating scale to figure out where somebody is up to from a functionality point of view. And as you can see, 40 and less is in bed more than 50% of the time, and then down to 10, which is comatose or barely rousable. So there are forms to be completed. As I said, it lasts for about 12 weeks. If the person survives after 12 weeks, there's an ability maybe to go to 16 weeks with unspent funds. So if there's anything left in that $25,000 allocation, they can continue to access that for another 4 weeks. If the client has been on a home care package, so they're already known to the aged care system and they're on a home care package, or if they're lucky enough to get a support at home classification, they can use whatever funds is in those classification or in their home care package to continue their support at home. If they do not have any services in place, like they're waiting for their support at home allocation, they can have a support plan review. Their provider can put that into My Aged Care and have a review of their care needs. So as I said, to access the pathway, it needs to be life expectancy of 3 months or less, the KPS score 40 or below. An end of life pathway form needs to be completed by a medical or nurse practitioner or a palliative care specialist, and this form needs to be attached to the request for assessment so the assessment organisation can verify it and activate the pathway electronically on the system. The next slide talks about the form. So if you go to the next slide again, Part A needs to be completed. So Part A is on the left-hand side. That needs to be completed by the client or their support person. So if the individual themselves cannot consent or do anything, their support person is more than able to complete that form and sign on their behalf. And then Part B is completed by the medical or nurse practitioner, paying close attention to section 13, which asks for the estimated expectancy, life expectancy in months, and also the AKPS score. If you, as a GP, are completing this form, you don't need to complete the medical practitioner, nurse practitioner details. They say that they'll accept a provider stamp. And then there is a bit of toing and froing about how the form gets uploaded so the assessment organisation can access it. So the next slide is just looking at a very simplified pathway, but it's going to be wrought with difficulties for you guys as GPs. As GPs, you can apply through GP e-referral for My Aged Care for an assessment to take place, complete the process and tick that this is for an end-of-life pathway assessment. And then it'll ask you to upload the end-of-life form. There's other advice that because this is quite difficult within GP land, that the form is completed at the GP surgery and given to the client, and then they either go to their provider to help them apply for a My Aged Care assessment for end of life, or they go to an aged care specialist officer in Services New South Wales, or they do a self-referral, and then it's up to the assessment organisations to try to manage getting access to the form. So we can say, yes, we've done everything, and this client is eligible for the end-of-life pathway. So it's a bit of a grey area for everybody, but we'll just have to navigate it. So exiting the pathway, the person passes away. That is probably the result of most of the end-of-life pathways. Or if the older person no longer wishes to stay at home, or the family just cannot support them even with the extra supports to the end of life pathway, and they need to enter hospice, hospital, or residential care, that's another way of exiting. The other way of exiting is that the client survives more than the 12 to 16 weeks. So they will exit because the maximum funding period is 16 weeks. There's only ever one end of life pathway funding available to a person. It cannot be repeated again. So if you have a client who has accessed the end of life pathway in 2025 and they survive, and then they want to access it again in 2026 because they are in the terminal phases of life, they are not eligible to apply for it. They will have to just stay at home with the support at home classification. This is just a bit of housekeeping that if a client does need to exit the pathway, their provider who's providing the end of life care can ask for an urgent support plan review, either to have a reassessment of care needs or for their latent classification for their support at home to be activated again, but that may be at a completely different level than what they require. So the providers will liaise with the assessment organisation to figure out what's the best way forward for that client. And I think that could be it. It is. Thank you so much.
Yeah, it was. Thanks very much. Now's a great time to pause and see if anyone's got questions at the moment for Louise. Done a great job. Nothing in the chat either at the moment. So that are the New South Wales state funded packages.
By way of introduction, my name's Janet Shields. I am the relationship manager for out of hospital care services, as well as an aged care program manager for geriatric medicine. So the out of hospital care packages, it's an umbrella term for compacts, SASH, and end of life packages. You may have heard of the compacts and the SASH previously. There are other packages very similar to the end of life packages, but we're here today to talk specifically about these. They are part of the end of out of hospital care, and they are funded by New South Wales Health, and they're managed by the LHDs, individual LHDs, in conjunction with New South Wales Health. All of this packages, the differences, which we'll get to soon, but all of the packages under end of life are non-clinical specifically. So that's the difference, I guess, between what you will have heard about under the aged care programs with My Aged Care. And they were brought into being, I think the end of life we've had for about 3 years now. And the reason they were brought in under this umbrella term of out of hospital care is to help support discharges from hospital and as well to prevent avoidable admissions. And the non-clinical care that is provided is low to medium. And they are for patients who are deteriorating or in the terminal phase, and they would like to remain at home. So we've had it about 3 years. It was actually taken over from, prior to that, it was called the last 48 hours of care that Hammond Care used to provide a number of years ago. So if we can go to the next slide. Sorry, thank you. So the packages are available to all age groups. Obviously, where children are concerned, it's more so to assist the parents who will be looking after the child, from birth up until teenage years. So the services are there to assist the actual parents. They are 6-week packages of care. However, we can repeat these. Often we'll have people who are unwell, and as you're probably aware, it's very difficult to gauge timeframes of people's diseases and when they might deteriorate, etc. So we can start small and just go in and do domestics or whatever, and then increase to various extra services, respite, personal care, and basically you're there to help the family as well. Now, the difference as well, referrals need to be made through New South Wales Health employees. And the reason for that is that the referral system is on our intranet. But the majority of the time, any one of those services, palliative care, community nursing, chronic and aged care, hospital in the home, all of those services are usually linked in with the patient's GP. So if you feel you have a client and they're linked with a New South Wales Health staff member, that staff member can put that end of life referral in. So that's the reason why. And it's a very responsive, it's a responsive service. So when we get a referral in, the provider, we approve it through the system, the provider contacts the client themselves or the representative, whether it be family member or carer, and they discuss, that's within 24 hours, and they discuss what services are required. Now, those services can be in place within 24 hours or maybe in a day or two, depending on the location and sometimes some of the areas, as you're probably very well aware, it's difficult to get providers in that area. And again, as I mentioned earlier, the other difference is that the end of life packages that we have, obviously they're shorter, they're 6 weeks, but they can be repeated ongoing. There's case management. So we have a case manager who's allocated specially to that person, and they review weekly with other health providers and the actual patient themselves. And we could also work alongside the clinical teams, chronic care, palliative care, HIF, and rehab. One thing I will say about these packages is that we won't be able to utilize them to supplement the Commonwealth Aged Care End of Life packages. So they're separate, apart from and separate. However, we can use them in conjunction with other services such as community health support program and Carer Gateway. And one of the things we do when someone's referred for an end of life package is recommend, if they haven't already, that they register and be referred to Carer Gateway, because they can also provide services. So just the next slide, please. Now, the differences which I've mentioned earlier between the New South Wales Health end of life packages and the My Aged Care end of life pathway is that there's no assessment required. So again, we'll go back to when it's referred, they're contacted within 24 hours, and then the services are in place between 24 and 48 hours, depending on location. And the referrals are specific. They're obviously some of the questions. There's no specific criteria other than they need to be around about between 3 to 6 months projected time frame, and the Karnofsky is 50 and under as a general guideline. So there's no assessment required. It's not age specific. It can be 3 to 6 months of life, Karnofsky of 50 or below. The packages can be repeated. It complements all the other supported home programs, and we can flex up and down in relation to what services are required. So I mentioned earlier that we can start off, if people are just going on the program, we can start off with some domestics and things like that. And as the family, it's uncomfortable, I suspect, when you've got somebody at home and they're palliative, and it can be difficult to have strangers, for want of a better description, coming in to help you. So we can start slow with domestics, and as the person may start to deteriorate, we can increase more services to help the family so they've got the time with the person who's palliative. And then there's just my contact details there if you have any queries, and or you can call the Aged Care Access Centre, who have information about this program as well.
That's great. Now, now's a good time to stop and just check if people have got questions, because these last few slides that I've got here are mostly resources that might be useful for you, where you want some guideline documents from My Aged Care, and there's an end-of-life pathway fact sheet for doctors and nurses. There's a general guidance document for health practitioners, and I've got a few other slides with information. So if you want to put your hand up and turn your camera on and join us if you've got a question, or if you're trying to eat dinner, drop it in the chat and we'll do our best to answer it. I see Meredith's just dropped a lot of these resources, the actual links to the website links for these resources in the chat, so that you can help yourself too. Slide
Diana,
is
I think there's a question in questions and answer about how does one access West New South Wales LHD intranet to make a referral from the community for New South Wales Health End of Life package? Is that the Aged Care Access Centre? Janet, do you want to answer that one?
Yeah, so because it's on the intranet, I mentioned that referrals have to be put in by a New South Wales Health employee, simply because it's through the internet and you have to log on with your staff link number and password. However, you can liaise with, depending on if you've got someone who needs assistance, you can liaise with a New South Wales Health staff member in your location about this patient and speak to them, whether it be a social worker, palliative care team, community health, hospital in the home, any one of those people that you have connections with in relation to that patient. So it has to be a New South Wales Health employee. Unfortunately, a GP cannot refer directly. You have to do it through a New South Wales Health staff member.
Sandra's just said, or perhaps send them to ED for them to refer. there would have to be a reason for them to have to present to emergency department. A referral for an end of life package would not be deemed as an emergency. I think the better referral pathway would be to contact a community-based staff member, such as a community-based nurse or a palliative care team, rather than sending them to the emergency department for a referral for end of life pathway, unless there was something acutely wrong with them and they needed emergency care.
Thanks, Louise. So this next slide is just patient resources. So these are resources specifically for your patients. There's a supported home booklet that's available for people, their families and carers. There is a webinar that's available, and there is a video they may choose to watch. It's fairly long, it's about an hour, but it also has presentations from OPAN and COTA and other organisations like that talking about the changes. And there is a supported home program end of life pathway flyer for people as well. If you want to order some hard copy resources to have in your practice, particularly the booklet, that would be a good one to have available for people in your waiting room, then you can contact the National Mailing and Marketing via email or ring them. Just tell them the resource you want, the quantity you need, and your address. They did say there might be some restrictions on the number of booklets, so I would expect a lot of practices will be asking for the current information to be sent out to them at the moment. So you might just have to do a couple of orders over the next few weeks if you want a larger number of resources. I've got some clinician and Aboriginal patient resources here. So these are resources for clinicians. If you've got Aboriginal clients, your patients, and you would like to be more culturally appropriate, particularly around palliative care, death and dying is very sensitive for Aboriginal people, of course. So knowing that you're using appropriate language and that you're being culturally sensitive is very appropriate for a caring GP. So these QR codes will work for you, as I've only just checked them yesterday actually. So these are resources for you if you'd like to explore those for your Aboriginal patients. And then additionally, I just wanted to mention two other organisations or programs that might be very supportive for you and your patients at this time. CareFinders. CareFinders is also listed on Health Pathways. It's listed on My Aged Care, and we've got a page on our website as well, because we have local care finders available across our footprint. Care finders are for our most vulnerable older people that typically don't have a carer to support them, and they typically are not connected to aged care services either at this point in time. So if you've got a patient that's experiencing difficulties, they may have cognitive difficulties, hearing difficulties, they might be a bit suspicious of the government and government programs, they may have a carer, but the carer can't assist them because of their own health or their own cognitive difficulties. So care finders will be there for you. And if it is a palliative patient and you're trying to connect them, then the care finders, if they have no aged care services in place, will be able to help register them on My Aged Care and help make sure that that referral gets processed in a timely way, and that if they need additional supports until the aged care palliative pathway is approved for them, that package of support, they will make sure that they are linked into the right people to help them. And Carers Gateway, they do have packages of support for carers, and that can help greatly and quite quickly with caring for one of your patients. So great time for any other questions before we wrap up for the evening. No. So look, I'd really like to thank Louise Rawson and Janet Shields for being here tonight to bring their expertise to us and to share with us all. I really appreciate it, their input and their support. As a PHN, we can't do the work we do without having great relationships with organisations and especially our local health districts. So thank you very much, Louise and Janet. I greatly appreciate you being here. I'd really like to encourage everyone to do the evaluation. Here's the QR code for it. but I see that the lovely Meredith has also dropped a survey link in the chat if you find that easier to use. It's not too onerous, and we really value your feedback. So if you could complete that before you sign off tonight, it'd be greatly appreciated. Yeah, and thank you very much to Natalie Camilleri, who's been sitting in the background in case we had general practice questions that needed answering. That's not part of my remit. So thank you very much, Natalie, for being on the line tonight. It was greatly appreciated. So if you could all fill in your evaluation survey, and we look forward to having you join us for another webinar another time.
Thank you. Bye.
Thank
Thanks.
you.